Now we'll try to answer the big question. Why is it that radiographers will only produce images only when requested? And why let me say an average person like you and I, we can't just walk into the radiography department and say, okay, we need x-ray, and they'll do it. Do you understand? So of course this is basically under the guidelines. There are rules, there are ethics of work. Do you understand? And we'll get to see the reasons why. So radiographers, you should know that they are trained professionals, and their role is focused on performing imaging procedures safely and accurately. Most of these imaging stuffs, they have their side effects on you. Do you understand? So they will only do this imaging stuff for you if the benefit of doing that image outweighs the fear that it should have for side effects. So the only person that can confirm that the benefits of this outweighs the fear for the side effects is a trained medical professional, of course. Okay, so legal and professional boundaries. Radiographers are not legally authorized to prescribe or request imaging. This is a responsibility of the medical practitioner, physician, dentist. They're the ones that will now take medical history, physical examination, probably treat you for a while before they say, this issue, I want to see how this body part is inside. Do you understand? So performing imagings without a valid request should be considered unlawful. Do you understand? And the radiographer will stand a risk of having their license retrieved. You get? So it's a well-organized workflow. This person is supposed to request, me, I'll come and do, send back the results. You understand? So that's what we got there. So clinical justification is imaging involve ionizing radiation and carries risk for side effects. So the practitioner is the one that said that the benefit outweighs the risk. This is what I've been singing from the first place. So diagnostic accuracy, the practitioner is the one that will now say, okay, it's not that you image the whole body of this person, but this particular place is where I need details from. They now go there, they do it. So radiographers then tailor the imaging technique to produce the best possible diagnostic images. So patient safety and ethical responsibilities. You have to limit images to practitioner requests to ensure that patients are not subjected to some unnecessary procedures. So accountability and documentation. Once you receive the imaging request, always write and document the name of the doctor that was calling for a particular request and all of that. You understand? So this ensures transparency, continuity, and even when the patient sues you guys, you can be able to stand in for each other. So that's what we got, and this is why this ethic is very strictly practiced.